Right. Good morning. Let's see. Oh, I got Melanie with me. Hello.
Good morning.
Nice that I'm not here by myself. All right. So I'm gonna kind of jump into things and we'll see if anybody else joins and if we get any questions at the end. I had a heck of a time trying to come up with like a pre-designed presentation for this topic. Um, I started out trying to make a slideshow and throwing in all my pictures of various horses and hooves, and I found that I just couldn't get it to flow in a direction that I wanted. So I decided instead I would just kind of talk through some of the things, and then I did go through and save a bunch of pictures of my horses and horses I have owned or worked with so that I could kind of point out some of the muscular things. I did not, I didn't pick out a whole bunch of hoof photos because I think, when I say long toe, low heel, most of you are going to understand what I'm talking about. And this discussion, I think, is going to head in the direction of more talking about the body and biomechanics as opposed to the hooves. So I just kind of wanted to say that, and preface this by saying I am certainly nowhere near close to knowing enough about the body and the biomechanics of the horse. I'm still learning. And so my purview and what I really am confident in talking about is the hoof below the coronary band. So this is kind of taking me, out of that realm a little bit. I'm happy to talk about my experience and what I see in these correlations, but just know that I'm by no means an expert on the subject, and I'm more than happy to learn more. In fact, I was hoping maybe I could put a couple of people from the group um, on the spot, maybe not today on this video, but hoping that maybe there's a couple people who would be interested in doing a bit of a presentation on what they know, because um, I know that they've been studying certain aspects of the body and biomechanics and also have that underlying knowledge of the hoof that they've been learning. And I think it would be really cool just to have that perspective. We haven't done a lot of that in the group. I haven't had a lot of people who were interested. I know at one point Lori was going to share some saddle fit and how she connected that to the hooves and whatnot, but that never happened, and she has since moved on. But either way, I was thinking, if you're interested in that, reach out to me. Off the top of my head, I would love to have a discussion about this with Nicole. If you are interested and you are watching this, I'll send you a message also. And Amanda, I know, is working on sternal rotation and rib cage rotation and learning all about that. And I would love to pick your brain and kind of have you chat a little bit about what you're learning if you're interested. And anybody else, working through that kind of stuff, I would love to learn more. So maybe we can learn from each other. Anyway, I have a list I have made here. I tried my best to fit it on one sheet of paper um, of things that I see in the hoof that immediately makes me think of something higher up in the body. And these are things that I've seen a ton of times. It's not just that I've seen it one time, or things that I've experienced with my own horses, which I think is a little bit more helpful because I can also share the perspective of what it felt like when I worked them and rode them, as opposed to just a client horse that I see it, but I don't necessarily know that feeling. I've often wondered how farriers who don't ride interpret and understand those types of things, because there are a lot of farriers that don't ride. And to me, like, I don't think you have to ride horses, but if we are going to ride horses and we're going to discuss these imbalances and movement asymmetries, um, I really think you have to understand that feeling and very subtly how the horse moves that feels different. We're going to talk a little bit about my paint mare Rain today, and I've got some photos to show of her. She, by far, was such an instrumental learning tool for me. That horse was born here. I know everything that ever happened to her. I mean, within reason, short of her slipping at night when I couldn't see. I started her only like two, maybe three people ever rode her besides me. And yet that horse had this ridiculous asymmetry. I could not work through it. She wasn't lame. I spent $20,000 vetting her, trying to figure out what the restriction was. And it was so subtle, most people would never have noticed it, but I felt it, and it was a big deal to me. So we'll talk about that as we go. And looking back through her photos actually is kind of telling. I see some things as a baby that maybe I should have been more aware of. Okay, so the biggest thing I see, like even if I'm just talking about feet and people who show up for trims or composite shoes or bring their horses to my courses or when I'm out in the field, is long toe, low heel, which we also call underrun heel. And so these are where the heel is really short and sucked under, and the toe is really long with a lack of connected hoof wall. This is a huge issue from a hoof standpoint. When we start to go down this road, we lose that lamellar attachment, which means we lose elevation of the coffin bone. This can come with or without rotation. If it's rotated, okay, we'll call it founder. If it's not rotated, we call it distal descent, which is a type of founder, just without the rotation. And just as a side note, a lot of vets don't recognize distal descent. This is relatively new in the last 10 years that we talk about the elevation of the coffin bone, and where they are measuring it is the extensor process, which is the front of the coffin bone where the extensor tendon comes down and attaches. And what Dr. Bowker says is that attachment point should be approximately 3 to 5 millimeters to the coronary band. Realistically, it should be elevated above it in a healthy, well-connected hoof. In most of these distal descent horses, it's sitting significantly lower than the coronary band and lower than that 3 to 5 millimeters. Um, I think the worst one I ever saw was probably about a half an inch lower. And the only way that works is because half of the bottom of the coffin bone has been eroded, because there is just not enough space in a hoof capsule for the coffin bone to be fully formed and sitting in that location. And so that's super sad, because we're not going to be able to fix that erosion around the coffin bone. But some of the things, like when I see a horse come in with these feet, I am immediately thinking about the body because I'm kind of a muscle nerd and obsessed with how horses move and develop. Right now, I wasn't always. Looking back through some of the photos I've picked out for this slideshow, like I'm riding my Arab Legend completely hollow and inverted, and like I didn't know what I didn't know. And so we all have to come from somewhere, but I do find it really interesting now that the more of these underrun heel horses I see, the more I see a wasted top line and an overdeveloped underline. So things like the pectorals, the underside of the neck, those are overdeveloped to try and support the horse. And the top line muscles, the back, like the top of the neck and through the back, are not super developed. And when I talk about top line muscles, I'm not even specific enough to get into the names of the muscles, but I literally mean all the way down the top of the neck, over the wither, on the back, over the lower back, up through the pelvis, and down the back of the leg. Like if you could color the whole top side of the horse, even down the back leg to the stifle, that's what I'm talking about. And if you reverse that and take your line from the horse's jaw all the way under the neck, over the pectorals, over the belly, and kind of down up into the groin area, those are the underline muscles. And learning, I've learned so little really in the scheme of things about all of this, but it was Celeste's masterclass that kind of opened my eyes up to how those muscle groups work independently from one another and that they can't all fire at the same time. And so if you are engaging, like way back when I was following Pirelli and learning about this, I didn't know the names of the muscles and even enough to call it underline or top line. But we looked at that big bulging underneck muscle. And my circle of friends that worked together, we called it the FU muscle because horses that were bulging in the base of the neck were usually literally very hard to deal with and essentially giving you the middle finger to say, like, I'm not doing that. They were the more stubborn, what we would call then disrespectful. I wouldn't call it that now, horses. Now I look at it and I say, okay, those are the dysfunctional horses that never really learned how to either carry weight, move appropriately, relax their muscles, and do all of those things. But, anyways, the long version is I see that on, I would say, almost 9 out of 10 of the horses with long toe underrun heel. I don't even know. I was sitting here this morning trying to find a picture of a well-muscled horse with an underrun heel. One of my photos. I didn't look online because it's really hard to do that when you don't know the history on the horse. I could not find a single picture of a well-muscled, biomechanically correct horse with a long toe underrun heel. Any of the pictures I found were horses that had come through the rehab and were starting to develop elevation of the coffin bone, and I'd already brought that toe way, way back. So that's kind of where my head goes. I immediately look up at the top line of the horse, which is usually underdeveloped, and the bottom is usually working too hard. These horses also tend to be prone to more tendon injuries and wind puffs, especially on the hind feet. Wind puffs is swelling of the tendon sheath just above the fetlock. That's very, very common, especially when we get into the negative angles on the hind feet, which is a, a negative angle is essentially a representation of a low heel, long toe. The toe is elevated, and so it reverses that angle that we should have in the bottom of the coffin bone. But we'll cover that a little bit more. Um, I also find horses with underrun heels and long toes typically struggle to engage their thoracic sling. And I don't think this is um, I don't know what the right word is here. I think they physically struggle to do it because of the posture of their foot and like where that positions their leg underneath their body. It causes it to be very hard, to lift up and hold themselves appropriately. Um, and so, it's really hard for me. Like 5 years ago, someone would come in with a horse like this, and I would just do my darndest to fix the foot, having looking at the body, seeing all these things, not really knowing how to articulate them. And, not very many people want advice on how to ride and work their horse from their farrier. I get it because way back when, had someone tried to tell me that, I would not have been receptive. So it's really hard for me now. I try to feel them out and be like, are you interested in talking about this or not? And if not, I'll just stay in my lane and do what I can do. But I will warn you, I may not be able to fix that. When it, and that's, I think, the piece in the last couple of years that's become so clear to me. It was actually a horse I had named Sunny. Um, he had the worst underrun heels I've ever seen, and he had erosion of his coffin bones. And he came to me like that as a rescue at like 20. And I worked and worked and worked at bringing those toes back. I had him in composite shoes. In fact, I think there's video of him in the group in the how-to of his composite shoes. Um, but everything I did, I couldn't fix his underrun heels. And I realized way near the end of my time with him that it was because of his body posture. He had kissing spine. He was a lesson horse that had been ridden hollow his whole life. He had zero top line. He had a massively underdeveloped or overdeveloped underline. And he was one of those super stubborn horses. And I now realize I don't think that stubbornness comes from an innate characteristic. I think a huge piece of it is dysfunction in the body, which creates tension, and the horse doesn't feel good moving forward. And that manifests as that stubborn, I don't want to. Go ahead, Brandy.
I also think it has a lot to do with their emotional ability to, like, they feel bad in their body, they've never been treated well, and so emotionally they have a hard time doing it as well, I think.
Agree. I agree. You know, It's super interesting what we expect and do with and to horses, and what they put up with. Like, I think there are days when, of course, I'm discouraged and upset, and I'm like, why isn't my training going according to plan? And then there's days when I just look at my horse and I'm like, I am so humbled you are even here with me. Like, so it's quite the for me at least, it's quite the emotional roller coaster. The older I get, the more I want to say soft I get. And instinctively in my brain, the word weak comes to mind. But I actually think that's just a defense mechanism. I think mature and educated and experienced are more apt words, that it's changing my whole perspective. But anyways, so I was trying to think about yesterday, like the biggest difference, like I always equate myself to a horse. When a horse comes in and has some type of locomotive issue, I immediately adopt it in my own body and go, okay, what muscles fire when I move like that could create tension? And I realize I am not a four-legged horse, so it doesn't totally translate. For instance, when I'm looking at a horse with a hind leg, I often walk backwards to try and simulate it because horses have a hock on the back, not a knee, and the leg bends the opposite direction. And so it's more appropriate for me to walk backward to simulate that. So I understand there's a little bit of a disconnect, but that's just me, and I'm trying to figure out how the horse feels. When I look at the thoracic sling and the front end of the horse, horses do not have a collarbone like we do. And I find this super interesting because myself, personally, as a human, maybe it's the job I do, trimming hooves, I tend to roll over. And my singular biggest physical struggle in life is that I restrict the nerves coming into my armpit through my pectoral muscles and compress them, and I have numbness in my arms, and the muscles behind my shoulder blades, quite literally until a couple years ago when I became aware of this, did not exist. I don't, like a horse with a weak top line, I don't think I'd ever used them. My arms just kind of floated in space, and the only reason I wasn't a hunchback is because my collarbone holds my shoulders up. And I had to relearn through physio, and I have a fantastic chiropractor. Calling her a chiropractor is terrible because she's not just a chiropractor. She's part physical therapist, part kinesiologist, also the coolest human I've ever met. And so working with her has really helped me to learn to fire and engage these muscles and hold myself structurally more supported. And like even just doing this, I feel like I'm like so ridiculously over exaggerating it. And I'm not. This is just where normal people sit. Like, exaggerating it would be one more. But for me, that's so feels so awkward because I'm always rolled in. And so now the first thing I look at when I look at a human is the slope of their shoulder and the angle, only because I'm curious and I'm trying to change it in me. So how does this apply to the horses? It's long-winded. I'm getting there. Um, I see so many horses go around like this because they do not have the collarbone like I do to force their shoulders back and down. And so their shoulders and their scapula kind of roll up and forward, almost in that picture of hawk. Let me, I don't want to pop back and forth too many times and make y'all sick, but this picture here of me, this was like several years ago riding hawk. But I look at his little jammed in neck right here and my completely ineffective halter and rein, and he is essentially doing what I was just saying. He's like jammed in like this. His thoracic sling is completely not engaged. His belly is hanging out. If he wasn't a young, strong horse, he'd be like a sway-backed old nag with my weight on top of him there. And he's just totally jammed in like this. And I see so many horses going around like that in constant dysfunction. And this posture, the way that it forces the limb to shift underneath them, causes underrun heels and long toes. You just you can't separate them, and it's not that it's not like a, I don't know what I want to say, like a genetic thing. It's pressure. Everything in the hoof, like the way the tubules grow, the excuse me, the angle of the hoof, it's all forged by pressure or lack thereof in how the hoof moves through space, lands on the ground, and breaks over. And so if you just think about going through life like this, like the mobility in my arms is restricted. If I could simulate that in my hips, it would absolutely change the way I walk and move, which would change the pressure distribution on my foot and the wear patterns in the bottom of my shoes, which is essentially more like the horse, how it's affecting the wear of their feet. So to me, the long toe underrun heel, um, they just go hand in hand with typically what we would call that inverted body posture or a less than appropriate muscling. And now I understand I don't really want to talk too much about genetics and specific things because there are some horses, that are bred to be a little more inverted, like an Arabian, versus a quarter horse that's bred to, or specifically the reining lines that are bred to be more um, down and long and low and round. And so, yes, obviously those two horses are going to be very different, but how we train and work them also plays a humongous role. Yes, go ahead.
About different breeds and how they're used, I have one quick question about race horses. Do you think they have their thoracic sling engaged while they're winning races?
Not at all.
Would
I
it help
think,
them, you think?
well,
Is that
absolutely. Okay, but yes and no. Yes and no. Because a horse is going to run the fastest when it's fleeing for its life. And they are not thinking about engaging their thoracic sling or coming under from behind or where their headset position is. None of that is important. I will probably also run the fastest when fleeing for my life. And I'm also not going to care about where my shoulders are in space, right? And so the problem for me with racing as an industry is all we care about is how fast they run.
yeah.
If, and jumping is the same, how high they can jump. We don't care about how it affects the horse. I don't even remember what it's called, but there's jumping and then there's like that super extreme jumping, where they like they're jumping 8, 10, 12 feet. Like it's insane. Those horses should not be doing that. But it's the pursuit of some like a completely unrealistic thing. If just for a minute,
And working cow horse, same thing. They just destroy horses for a living.
totally, and reining too. I love reining and I love dressage. In all of our disciplines, it can go too far and it's destroying horses. Reining could totally be done more effectively to protect the body of the horse, but those spins wouldn't be as fast, those sliding stops wouldn't be as cool. Like, do you know what I mean? And racing is no different. If overall the entire playing field of racing, if we focused more on developing the horse's body and having them move more correct, and then decided who won because they were fast within those parameters, it would be so much healthier for the horse. But that's a long ways off because in some of those industries and some people's views, not all of them, the horses become disposable and they don't care. They just want to win. Like that's our human nature to do everything. So I don't think they are moving correctly. I think they're moving hollow and inverted. I mean, how many racehorses have you seen with a beautiful top line and a nice balanced underline? Like none. They don't look like that. Racehorses that retire from the track sound and go on to be dressage horses, you might have a hope in seeing that, if they're trained appropriately and by someone who prioritizes their well-being. It's very, very rare. So yeah, I don't think racehorses are running appropriately. And if we look at the average age they're retired and the average age that thoroughbreds are put down, and their life expectancy, that right there is a statistic that tells us they're not doing it in an appropriate way to balance the horse. But, you know, I don't know what I can do about that. On a positive note, there are quite a few thoroughbred trainers starting to train and race barefoot. They're starting to put a bigger emphasis on the hoof. But okay, this is also cool to think about for me. Think of thoroughbred feet. Everybody, when we talk about thoroughbred feet, thinks of like crappy, thin walls, flat feet, no concavity, thoroughbred feet. Why do thoroughbreds have those feet? Is it genetic? Because I have actually seen thoroughbreds with really nice feet. And you know what thoroughbreds they're on? The ones that didn't hit the track. Because those horses are running in a state of dysfunction, and the pressure and release on their hooves are forging those feet. Now, that being said, there's genetically some with crap feet, like in anything. But I've seen some thoroughbreds with really nice feet and thicker hoof wall. But I can't say I've seen one off the track with beautiful feet.
Because I'm assuming, I don't know anything about racehorses. I'm assuming they shoe them from like 1 year age on.
Yeah, not quite that young, but as soon as they start racing, usually around 18 months, um, it's, and uh, there's so much to talk about to pick on racing as an industry, like how young they work them and how young they ride them. But honestly, those jockeys weigh nothing. So I don't think it's so much the weight on their back, it's the extreme speed and dysfunction that I have an issue with. But anyways, that's a whole nother topic. Okay, where were we? Talking about the long toe underrun heels. I think that's essentially, I'm gonna kind of go through each topic and then I'm gonna pick through the pictures I've selected because I don't want to be sharing my screen and jumping back and forth. I'll make y'all seasick. So we'll kind of work like that. Next on my list is high, low, and clubfoot. This is a massive one that 10 years ago me would just balance each foot to be appropriate to what it was and not worry so much about the rest of the horse's body. And it was my paint horse Rain that taught me that lesson over and over and over. She was I think born with dysfunction, I'm gonna say. She was the first foal I had here. My mare went a month overdue with her. When she was born, she was gigantic. She got stuck in the birth canal. I had to help deliver her. Um, it was very, very cool, but also terrifying. And right from the get-go, like her legs were so long as a foal, her head couldn't reach the ground to attempt to nibble the grass and graze. And that didn't really balance out till she was a year and a half old. And so she had to splay her legs to reach the ground. And looking at pictures of her a couple days after birth, I can actually see that her left front was slightly more upright and contracted, probably due to her placement within the womb. Whether that one was tucked a little more under or whatever, we don't know. But right from the get-go, it was a bit of a concern. And when the vet came out at about 6 months of age, he could see that developing and he was like, we need to take her in and cut that tendon so that it heals with scar tissue in it to elongate it so that she will be balanced. And I was like, no way, we are not doing that. And now I kind of wonder, I don't think it would have helped, quite honestly, but that horse is one for me that I couldn't fix. And so I'm always thinking about those things. Yeah, go ahead.
Have you heard Celeste talk about birth canal affecting their, she calls it their wings, which I'm kind of blanking. I can't scientifically speak about that, but they can get scrunched up during birth and then cause these types of abnormalities for the rest of their life if they don't get, fascia worked out and structurally changed. Is
Yeah,
that tied
absolutely.
to this horse, do you think?
Maybe. I don't see it so much as a specific birth trauma in the sense of like the moment she was born. I think for her it was more her position inside, and the fact that she just went way overdue and there was not enough space in there for her. But I did work a lot with Celeste on this horse. That was kind of the beginning of how I found Celeste in her masterclass. And Celeste and I did several virtual sessions where she talked me through working with this horse. At one point, I was actually going to go drop her off at Celeste's house for 6 months of rehab, but I ended up not. It was, thank goodness, because I spent enough money on that horse. But anyways, I don't know. I don't know enough about it like Celeste does. But I think it was more positional. Anyways, what was I talking about? High low. This horse developed one high, one low. It affected her entire life. I worked as hard as I could to keep those heels even and to elongate the tendons in the upright leg and to keep the heels back and up on the low leg. Like most people, when they would look at her, would not notice it because I managed it meticulously from birth. And so when the vet said he wanted to sever that, I was like, no way. I would rather have an imbalance than a weakness like scar tissue on a tendon like that. To me, that would have set her up for failure later on. And instead, what I did was derail her from ever having a performance career. I think if we had cut it and allowed it to heal like that, she probably could have done some high performance work, but it would have been a very short career because of that liability. And it didn't really matter to me. I was never going to do anything performance based with her anyhow. So, she lives a wonderful life and is sound and happy to be a trail horse, but she's just not I don't know what the right word is, balanced enough to do more meticulous things. So anyways, when I look at the high-low, and I don't care if we call it a club foot or not a club foot, to me, a club foot is a conformational abnormality. It is usually, it adjusts the shape of the bone. They are born with it. It's not developed. A clubfoot is literally like that front coffin bone should be somewhere around 48 degrees with the dorsal angle of it. And I don't mean the angle in relation to the ground. I mean, if you literally could pull the bone out of the foot and put it on the table, it would be around that 48 degrees. And a clubfoot is conformationally steeper. And there's varying degrees of clubfoot based on the steepness of that bone, but somewhere around 55 degrees and up, we start to call call it a club foot. And literally it's the angle of the dorsal aspect of that coffin bone would be from a flat surface. But we're not talking about growing the heels or lowering the heels to change that angle. We're just talking about the bone. But it doesn't matter to me because a club foot creates a high-low scenario. And a high-low scenario without a club foot is simply like my mare. She did not genetically have a club foot, but she had a high-low anyway based on, a little bit of excess tension in the back of that left front versus not having that in the right front. And so I had to manage it. From a foot perspective, it's a little bit tricky, but not necessarily super hard to manage. I want to trim the heels on the high foot as low as I possibly can. That doesn't mean I'm going to invade the sole, thin the sole, or cause problems, but as low as I can while protecting everything. And then I am going to allow the heels to grow on the low foot to match. I didn't always treat it this way. For a long time, I treated each hoof as an individual. And then I started to notice restriction in the horse's body, and tension and asymmetry in the way they moved. Typically, the high side of the horse, like on my mare, it was her left front, meant she was way more restricted on the left side of her rib cage. She had a really hard time bending to the left. And if you think about that, like just think about you're on all fours and you lift one side up. Now try to bend that way. Like it just doesn't really work. It's not conducive because the ribs are up and arched. And it was the same thing for her. You could go right anywhere you want. It was beautiful. We could bend and it was symmetrical and she could step under with the hind. But trying to go left, we could not pick up a left canter lead. She would pick up the wrong lead every single time, no matter how hard I tried. Even interestingly, the diagonal of her trot left, she would always double bounce me to the wrong diagonal. And I could not explain that to the vet. I was like, her diagonal is wrong. He's like, well, then change your posting. And I'm like, no, that's not it because she bounces me to the wrong one. Because she was counterflexed, it was almost impossible for me to stay on the right diagonal. I had to constantly change. Like, it should not be that hard to ride a rising trot on a horse, but on her, it was impossible because of that rotation through her rib cage. And now that I'm more aware of that, I see it a lot in high-low. Even my Arabian, he had a genetic clubfoot, um, or has. He's still alive. He'll be 30 this year. Um, I never knew it at the time riding him, but he was always much better to the left than he was to the right, and the right was his clubfoot side. So now, in looking back, I'm like, well, that makes great sense. I also didn't have the knowledge to help him through it like I did with her. With her, I did a ton of Celeste pillar work. On engaging her thoracic sling, and she got so much better at attempting to bend through, but never really to the point she was symmetrical. Let's see. Where am I? The high side is the shorter side as well. So typically the stride is shorter on the high side, which also is an issue if you're looking for symmetry. If you're just trail riding, not the end of the world. And you get more knee action on the high side, which is going to change the development higher up as well. And so a lot of times horses with high-low have more muscular tension and development on the high side than they do the low side. The scapula is actually sitting a little lower and relaxed on that low side, whereas the high side, it's kind of jammed up and it can be really tight. And the serratus ventralis underneath the scapula can be a lot more tense as well. Let's see. These horses are also super tight at the base of the neck and through the shoulders. Like I just see more tension and down into the pectorals as well. Again, because of that lack of balance or stability, one side is always going to be working harder no matter what direction they're going. And so it just tends to create a little bit more restriction. And so for me, from a hoof care provider perspective, well, I want to trim the feet and balance them the best I can, but now that I know what I know from a riding perspective, I'm going to sacrifice that low foot. And what I mean by that is I'm going to allow the heels to grow long. I might even wedge it. I'm going to match it to the high foot so that I can create balance higher up for the horse. Back when I didn't know anything, I didn't do that. And, that caused a lot of imbalance for the rider. A saddle is never going to fit a horse with high-low if you don't attempt to balance the feet, because the high scapula is going to be higher than the low one, and the saddle's always going to be twisted and falling. And because that higher scapula is up, as it comes back through motion, it's going to be grating on the saddle with more pressure than on the other side. And so that has become a huge priority for me to find symmetry in those horses. Mostly if they're riding horses. Now, if we're talking a broodmare or an unridden horse, well, that's a lot different. It is still going to create that muscle imbalance in the horse, but now we're not talking about weight distribution of a rider, saddle fit, bending. Nobody cares what lead they canter on. So that doesn't mean I won't still try to balance the feet, but it is much less of a concern because it's not causing those major cascade effects that are amplified with the weight of the rider. Okay, while we're talking about shoulders and thoracic sling, high heels on front feet. I rarely see high heels on hind feet, so that's not usually a thing. But high heels on front feet typically are because they have a lack of connected dorsal hoof wall. And if we just grow the heels higher, it hides that. I mean, not how I would do it, but that's what I see a lot around here. Those high heels essentially create like that high low. And when I was talking about the high foot, how it arcs the scapula up and it creates tension underneath the scapula, and the base of the neck at C7 tends to be jammed in. Well, you just see this bilaterally now with high heels, and these horses tend to be kind of short necked, if you will. And not that they're genetically that way, but that's just the way they move. And then as we bring those heels down, we can get a little more scope out of their neck. I typically see these horses with high heels, they have weak frogs and digital cushions because the heels are lifting those up off the ground and they're not getting stimulation. Anytime you have a high heel, you have a shorter stride as well, just because of the way the limb articulates through space in the stride. In order to get that heel up off the ground, they have to lift higher with the knee. And anytime you go higher, you lose extension. So we want this delicate balance of the limb coming up, arcing through space and extending out. I mean, we want a little height in that, but if you try to exaggerate it, you'll end up with a shorter stride. And if we think about some of the torturous things us humans do to horses in the gaited horse worlds, in order to accentuate the knee action, they put the blocks and the pads and the stacks on those horses to, grow the heel by 4 or 6 inches. And it's because it causes that high knee action, which is catastrophic for the shoulder and the base of the neck and all the tension those horses carry. But it's the knee action they're looking for. And if you look at any of those things, the stride is a lot shorter than, say, an extended trot of a dressage horse. And not that dressage can't be torturous also, but I'm talking about the good ones. Okay, surely there are some. Or the horse strutting through the pasture with an extended trot. How about that? We've all seen that and gone like, oh my gosh, why don't you do that when I ride you? Which is pretty cool if you can ever get to that. Okay, what else? High heels on fronts. Let me see. Okay, I want to shift a little bit and talk about medial-lateral imbalance. And I want to talk about it when we talked about high-low, I'm talking about imbalance from one foot to the other, like on the front feet, say. But I want to talk about medial-lateral imbalance in just the hoof. So say the inside heel is higher than the outside heel on one specific hoof. A lot of times this can be trimming error. Maybe the last trim, it didn't get trimmed to be in balance, but it can also be asymmetrical movement of the limb that causes that wear pattern. And so we have to think about that from both perspectives. Anytime I pick up a hoof and it's not even, I don't immediately just think, oh, someone trimmed it wrong. I trim horses all the time, and when I come back 4 weeks later, they're crooked. And so I don't think it's always that I've trimmed it inappropriately. I think more about the way the horse is utilizing that limb. Maybe they're loading unevenly, or maybe they're wearing one side more than the other. My foxtrotter mare is very turned in at the hock, which causes her medial heels to grow a little higher than her lateral heels. The other thing I have been really learning the last, I don't know, month and a half is when she trots, she has a huge wobble to her hocks. Like they go out very wide. Trotting is not a natural gait for her. And it's really hard to interpret because I watch it and I'm like, is she lame? Like even on both sides. So I don't think it's a lameness. It's just the way she trots through her pelvis and hind end. But it creates a twist as she lands. And I think that both the fact that she's turned in at the hock, but also moves like that, wears that lateral heel just a little bit more than the medial heel as well, with the twist. So she's got both things working against her. And so every time I trim her, her hind heels are uneven. And if I were to leave them and trim them crooked and just say, oh, that's how she is, I'm going to exacerbate that problem. And so I do my darndest to keep them balanced, which usually means I just do a couple swipes on that lateral heel to balance it, and I don't touch the medial heel. If the medial heel were too low, I'm not going to over lower the lateral heel to match it. I'm just going to lower it to an appropriate level. And that is going to be as close as we can get to balance without adding something. Like we can usually, you can use some glue, some super fast or adhere to build a synthetic heel, or we could use a shoe and maybe wedge one side, something like that. I'm really leery about doing things like that because anytime we wedge mediolaterally on one hoof, you affect symmetry in those joints all the way up the leg. And so if she is born with her joints angling on a hocked in or turned in at the hock perspective, and I force them out, I'm going to be putting undue stress on them. So I'm really super careful with that. Little bit different on like an angular deformity in a foal, but in a fully grown, joints are developed and growth plates are fused, I'm going to be a lot more cautious in doing anything like that. Back in the day when I was a kid, I had a thoroughbred off the track, and he was so crooked in his front feet and he interfered so bad that as he trotted, he would actually cut open his front fetlocks with the other foot by hitting them. And I didn't know anything. We just brought brushing boots, so he couldn't do it. But the farrier at the time would come in and he would wedge up those inside heels, like, and I'm talking like a half an inch higher than the laterals, and that horse would move perfectly straight. Which at the time we were like, he's a miracle worker. And then 3 years later, I retired that horse because he had severe pastern arthritis. And so it probably would have been better to leave him crooked and let him interfere and use the brushing boots to stop it, as opposed to forcing those limbs straight. Because at the time, he was way too old. I think he was 17 or 18 when I got him, and there was no changing that. It was just causing, or it was taking the stress from one spot and putting it somewhere else. And where it was initially wasn't really causing long-term damage. So, that's a little bit scary that we do that still. And it can be done, but there's a time and a place. Okay, where am I on my list? Okay, the medial-lateral imbalance. A couple other things I see is, again, that super tight serratus ventralis under the scapula, just under the front of the scapula, tends to bulge. And as well, they tend to be really tight and imbalanced in the pectorals. I think from a muscular perspective, the pectoral muscles are one of the big ones we miss as horse owners. I mean, I'm sure body workers and people in the know focus on them a little bit more. I think when we ride a horse or work a horse in a less than correct manner, and sometimes you got to work through that to get to correct, they carry so much tension in those pectoral muscles that affect the arc of the stride, the length of the stride, the bend in the horse. Like I think they are underrated, and they actually affect so much more than we give them credit to. And horses with medial-lateral imbalance on the front, I tend to find a lot of tension there. Before I knew a whole lot about massage, I got into acupressure way back. And nothing crazy, but just looking for acupressure points and applying just a hold, like very light pressure with a fingertip. And when I'm trimming horses, still to this day, if I need a break or the horse needs a break, like if I need to stretch my back or the owner wants to talk to me or the horse needs a second, I typically will hold an acupressure point while I'm taking a break from trimming. And to most owners, it looks like I'm just leaning a hand on the horse. They have no idea. And except for when I'm down at the pectorals, if I'm working on a front leg and the horse seems tight just in holding their leg or bringing it forward, I like to use those acupressure points on the pectoral muscles, and I find a huge difference. And I actually think back when we learned about acupressure, it was very specific. Like you would feel through the muscle fiber for specific locations to apply pressure, and I think that's great. I think the more accurate we are, the better. But I have found through the years, and now learning a little bit more about Masterson method, you don't have to be in the right spot. You can be almost anywhere on a muscle, and if it's holding tension, you will release it with a light pressure. And I am learning. I'm probably too firm in my pressure. I want to get in there and affect a change. When I go for a massage, I'm like, just as hard as you can go, and I'll grin and bear it because I'll feel better later. But that attitude does not work with horses. It makes them hold more tension. And that is still something I struggle with every day, which is kind of why I'm focusing on Masterson method this year, because it forces me to be light. But in saying that, I do find that there are some horses that are a little similar to me and like a little more pressure. And so I'm experimenting through this, and the same goes for the acupressure. But pectoral muscles with these mediolateral imbalances can be like the secret spot where the horse looks at you like, how did you know? And it's not magical. It's because when that leg is crooked, like if even if you just pretend your arm is a leg and you tip one side of your hand upward, you feel it in your pectoral muscle immediately. Now put 800 pounds on that and see how much different it's going to feel for the horse. Okay, medial lateral imbalance in the hinds. We talked about turned in at the hocks. Typically, if there's a medial lateral imbalance going on in a hindfoot, it's a joint problem. Usually, it's a crooked joint problem. Usually, stifle hock, fetlock pastern, not typically higher up in the pelvis, but to me, it's always worth investigating. If your horse is turned in at the hock and you have a slight imbalance, no big deal. Assuming the imbalance is equal side to side. If the imbalance is not equal side to side, then I would start investigating more joints, x-rays, and trying to look for things. I'm on that mission right now with my fox trotter. With her, she's got some imbalance in the hind end in the way she moves. She has more of a twist in the left side than the right side. And I am preventatively having the vet out on the second. I want to x-ray every joint in her hind end and ultrasound it and just make sure there's nothing wrong. Make sure that it is a compensatory issue, probably from when she broke her leg. But I just want to be sure, because if there is any sign of arthritis or calcification in those joints, then I need to make decisions based off of that and not just keep attempting to ride her through the weakness, or I'm going to make it worse. Let's see. Okay, wearing off the toes. This is one I see sometimes. That foxtrotter, she's one of them. Not all the time, but sometimes she'll wear the hind toes off. Wearing off the toes to me equals a lack of elevation in the stride, if I put it simply. I'm like, the hoof is not arcing high enough up through the stride. That can happen for several reasons. The heel can be too low. That's easy if it's that. It's usually not, though. Typically, the horses that wear the toe have a higher heel. Um, if it's in the front, I immediately jump to lack of engagement of the thoracic sling. Like it's just not, there's no lift. The horse is not carrying themselves. They're just letting their shoulders kind of slump up to their neck. And if it's in the hind end, I tend to go to pelvic or SI right away. Usually you can palpate the lumbar in the lower back around the SI and feel some tenderness up there. And so, I would start looking higher up. Horses don't drag their toes generally because there's something wrong with the foot, unless their toes are ridiculously long and it's compounded by a body issue and they can't lift it high enough up. But that's like a one-off and not really what I'm talking about. I more so mean a fairly nice-footed horse that starts dragging their toes off. And dragging toes off is very different than landing toe first and wearing toes. Totally different. Dragging a toe creates that like super accentuated bevel that's very flat on the front, as opposed to a horse that lands toe first can wear, a more forward flat toe and like a harder toe callus, but it's not quite the same thing. Let's see. So that bringing us into toe first landing, when I pick up a foot and either I see a super thrushy frog, a very weak back of the foot, like a lack of digital cushion space, or a high heel where all of that is starting to atrophy, again, I go to like down the navicular syndrome path. We're trying not to call it that anymore, but either way, I look for toe first landings. Usually, with a toe first landing, a horse can't possibly engage their thoracic sling. If they're not, so this is where I kind of got lost in the masterclass with Celeste's work, is some of the higher up people were thinking or saying that the horse was super developed in their body, yet I was still seeing toe first landings in the way they were moving. And so I was not satisfied with that. Um, I think in order to be, I don't know what the right term is, like fully correct or more correct or rehabbed or whatever, I think you need both. I think you need proper biomechanical movement through the body, and you can't possibly have that if the hoof is not biomechanically correct as well. If you are still landing flatter on the toe, something is still restricted. And so that's where I kind of didn't leave and abandon it. I still every now and again poke my head in there and have a look. There's lots more to be learned, but I sort of started looking for more when I started to see that, and so I'm continuing to still look for more in anything that I do. But I need to see all of that, and so for me, anytime a horse is not landing heel first, I'm worried about the breakdown of the internal structures of the hoof. But I'm also thinking about, up higher, how that horse is moving. They are going to be tight in their shoulders. Their thoracic sling is not functioning as well as it possibly could. They're usually jammed in the base of the neck, and they tend to be those horses that I want to say uh, affect their motion with the front end. Like they're dragging themselves around on the front end. They sometimes need to be a little more hoppy. Not so much lame, like head bobbing lame, but hoppy on the front end to like get that big old front end up off the ground to move forward. The hind end is not pushing them through. They're like the horses where the hind end just kind of flaps in the breeze because they're so front end heavy. Because you just can't extend that leg out and make the stride in an appropriate way if they're going to come short and land on the toe. They typically have a lack of top line just because they move like that. I would love to see, like, if any of you have a horse that lands toe first, but you think moves biomechanically correct with well-developed top line, that is my mission in preparing for this presentation. I'm like, I don't think that exists. But if it does, prove me wrong. But I've yet to see it. Okay. Okay, I want to talk a little bit about the negative angles as well, or NPA. We call it palmar and plantar. I just call it NPA because I don't really care if it's the front or the back. It causes the same problems. But typically in a front hoof, if you have a negative angle, you've got an underrun heel, a long toe, and all the stuff we've already talked about with the jammed in shoulders and base of the neck. It's hard for the horse to articulate through the stride. It's going to be shorter just because of all of those issues. When I see a negative angle in the hind, I saw one yesterday actually. A lady trailered her horse into me, and the first thing I noticed was just how the horse was standing in the stall for me, like when I was talking to the owner. That hind end was so far underneath, trying to support itself, and it just looked sore. Like it just looked like she was constantly shifting her weight. She was going back and forward. Like she just couldn't get comfortable. And this was beyond like, I'm at a new place, I might be nervous. This horse was actually pretty chill to come to a new place. She's done a lot of things, so that's not new to her. But definitely just seemed uncomfortable to me. And looking at the feet, it was a pretty clear to me there was a negative angle, or at least a ground parallel at rest, meaning negative at peak impact. And the horse had wind puffs up the back of the pastern. Um, things that I think about when I start to see that is the rotation of the pelvis. Anytime you have a negative angle in the back feet, the horse has to kind of tuck their pelvis underneath them just a little bit in order to stabilize. So you see that little bit of rotation in the pelvis, which raises the lower lumbar. Those horses are almost always sore there. Now, to be fair, most horses are sore there. Like, you know how people will take their fingers or a pen or a hoof pick and like rub it down the lower back and the horses will just shudder. I find you can make any horse do that, whether they are sore or not. So you have to be really careful watching something like that. But if you can't even gently curry their lower back without them tensing, it's a good bet that there's some type of discomfort going on. And these horses with negative angles, it tends to be exacerbated just because of that little rotation of the pelvis and how it affects that lower back. Um, Horses that are chronically NPA for a long, long time can develop stifle pathology as well. And so you really do want to be careful with it. It's not just a soft tissue thing. I've heard people say, yeah, I'll deal with that after. I'm working on this right now. And to me, I'm like, well, you really need to work on it all because you're risking those stifles. And once those lesions or arthritis develops, you're not going to be able to do anything about it. So that's kind of what I think about. These horses also tend to not track up super nice in their hind end. So if I'm watching them move, that's something else I'm looking for. Or if I'm just watching a horse move and it's not tracking up, NPA is one of those little flags that goes on in my brain. Like we should look at that and make sure that we don't have that negative angle. Um,
What do you mean by tracking up? I don't understand.
like the hind leg, if you watch a horse move at a trot on a circle, if you look at the footprint where the front foot is, the hind foot should at least track to that same footprint or over it, usually further ahead. But there's a lot of horses where that inside hind won't even come close to where that inside front was. And you can watch it, like I can usually see it just by watching the limb in motion. But if you can't, watch the sand or whatever footing you're on. Like watch the front foot hit the ground and keep your eye on that spot and watch for the hind foot. They typically don't track up super well, and they also struggle to engage that inside hind under. Like if you were yielding a hind end away, they can't quite get it underneath there because everything is super tight. All right, the last thing on my list before we kind of go into my pictures is this is one I've been also thinking about. I had a really cool discussion with a body worker about it. Horses that can't stand on three legs for trimming. Um, to me, this is super irritating. I'm like, I'm trying to help you, and I can't help you if you won't let me. And they keep kind of falling and stomping a foot down. Usually, these horses are disconnected through their body. And what I mean by that is like, you can tell the difference between a horse that feels all four legs and knows exactly how to balance themselves before you pick up that foot, and a horse that just feels like they have four independent legs that are not connected at all. Like they have no concept that they can't pick up that other one while you're holding this one. And I don't think that's a like I don't want to say stupid horse, but like a dumb horse who can't figure that out. It's a proprioception issue, probably along a neurological strain where the horse is actually disconnected or disunited. They're tight through the back. They typically, this body worker was telling me they find a lot of tight fascial connections through the backs of these horses that are disconnected. And just through doing regular, I don't know what you want to call it, like biomechanical work or whatever. I would do like working on a bend, correct balance on a circle, not just mindless lunging or working, but really helping the horse at a much slower, like bring it all back to zero. Like do it at a standstill. Just stand here and be balanced on four legs and lower your head and release your under neck and engage some of those top line muscles and thoracic sling. And now can we walk? And through doing those little exercises and gradually building it out to at a trot or at a canter at a farther distance where we can sustain it, you tend to create more connection through those horses. But again, it seems like a pattern to me. These horses also tend to be have a lack of top line development and the underline is like overdeveloped and on fire. So that's kind of the pattern I see. Um, I hope I didn't miss anything. Those were the things that came to my head in the last couple of days or a week while I was thinking about this. Um, and it seems to me like I hope that everybody in this group understands this connection and you're not just like, oh my God, she's talking about biomechanics again. Like, when are we going to talk about feet? Because I wish I could just talk about feet. I wish I could forget all of this. I wish I never met Celeste. I wish I never saw the masterclass. I wish I never learned to see this dysfunction because now I can't unsee it. And it has changed Every single thing I do. I was just reading an article on Facebook this morning by Lockie Phillips about where did natural horsemanship go. Um, and I found it really impactful to me. And it kind of fits into this because back in the day when we all did natural horsemanship, it was like this fringe thing, and you didn't tell people you did it because they would probably make fun of you. Um, and we got like I mean me, okay, I got really good at making horses do things in from that natural horsemanship perspective. They could, like, I remember when I was trying to pass my Pirelli level 3, one of the prerequisites was you could send your horse out on that 22-foot line on a circle at the canter, and they could do like 30 laps without breaking gait. And man, I practiced that. And so yeah, okay, I could stand here, send my horse out, and I could just pass the rope. Like, I just taught my horse to completely ignore me for 30 laps. Don't feel me. Don't break gait. Just be a mindless robot. And now I work so hard to have my horse feel me. I can't not turn with them. I have to be there and be present and have that feel through the rope. So much different. Because when I look back at the video, like of my audition that I had sent in, like, here, look at me. All I see is a horse moving in dysfunction. They're leaning out, the inside shoulders dropped. I practiced that for 30 laps in that video, and how many hundreds more not on the video that I practiced the dysfunction. And so what I thought was cool about this article this morning is he's saying, okay, natural horsemanship is now gone. And in his perspective, he calls it now emotional horsemanship. I've been working on, like, I was following Josh Nichols' program. He calls that relational horsemanship. I don't care what you call it. I still want to call it natural horsemanship because to me, it feels natural working with the horse. And I don't think all those things that I learned in natural horsemanship are gone and obsolete. I'm still going to go out and circle my horse and move my horse and do all of these things, but now I'm doing them with more feel. Way more feel than I ever did in natural horsemanship. And so I don't think it's bad or evil or horrible. And I think I at least am so, so grateful for my foundation in that. It kept me safe, man, with some of the crazy horses I had. But now I'm just evolving into something more. Go ahead, Brandy.
That's how I think about it because I follow a lot of people in a lot of different industries, and like it's really hard for one person to teach everything extremely well, is how I view it.
100%. And you know what I always found as a disconnect for me when I was practicing Pirelli? I would watch the Pirellis with their horses, and like their horses weren't looking out on the circle. Their horses weren't inverted. Their horses were doing everything correctly. And yet, when you watch their teaching, or like when you're at a clinic or doing something, then not them. I never worked specifically with Pat Pirelli anyway. Um, they never addressed that. It was more like, is your horse doing it? And I'd be like, yeah, but my horse is doing it inverted. And it'd be like, well, that's okay for now. Well, when did it change? Because it never changed for my horse. And so I find it really interesting. And you're exactly right. Even if someone is a masterful teacher at something, it's not going to resonate with every student and be interpreted in the same way. And so I find it really interesting, no matter who I'm working with now. And I think I look at learning in a different lens too. It's like take in what you can take and watch and what they're doing, and then interpret it in your own way that works with the relationship you've built with your horse, or for me with my dog or whatever I'm doing. I think it's just a little bit different. But anyways, okay, I want to pop through all of these pictures, and I apologize. It's going to be a lot of opening and closing pictures, so I hope you don't all get sick. I tried to go through some pictures I had and pick out what I wanted to talk about. I want to start with my baby horse Rain here. This is my paint with the high-low. So I don't know how old she is here, couple of weeks, months old. But look at this left front and how upright it is versus this right front. And it's just subtle. It's not like significantly different, but this was her upright high foot, and we did x-ray it. It was not a club foot in terms of the dorsal angle of the coffin bone. It was just more contracted through the tendons on the back of the leg versus the right. But this ended up creating an imbalance in her that I saw for the rest of her life. And like you had suggested, Brandy, about the wings and the birth trauma, like I didn't know enough back then to look at, her scapula and be like, are they even and equal? Looking through some of my pictures, they seem pretty close. I for sure could have benefited from helping her. I really think, like, she was all legs. I really think it was probably positional, but that was her when she was little. And then as I watched her grow, this left front was always back. Always, no matter what she was doing, that's how it worked. And I know this is not the greatest picture because she's eating and whatever, but her thoracic sling was also never engaged. She just kind of hung on it, and let it support her. She did not carry herself. Not until later when I learned about it and was working with Celeste. But same thing. This hind leg was always, always back. This side was always very restricted. She happens to be looking the other way, but the ribs were always bending to this side, which made it impossible for her to come around and bend that way. Where else is she? Oh, that's a very tiny picture. Same thing though. You can see how that leg is always back. I wish that one was bigger actually, because we'll use this one. But one thing I noticed on her is underneath her scapula, you can kind of see the outline of the bone here. This serratus ventralis muscle that's right in front of it, kind of underneath, was always massive and bulging. Like it was never soft and relaxed, no matter what I did. And the base of her neck always seemed very jammed in. Um, this was a picture of me riding her, and it's hard to tell with her mane, but this scapula on the left, on the high side, was always bulging and upright, and on this side, it's non-existent. Like, and I was always falling that way, and her feet were balanced, but it was structural through her body. And I always noticed just a little bit of an arc in her neck. Even though her head is to the left, her neck is shifting to the right. And this was kind of the main reason I found an issue with this horse is she tried her heart out for me, man. Like she tried so hard to get that left lead and she tried to find that bend. She had so much effort. And I finally stopped trying because I knew how hard it was for her. I ended up selling her to a friend who does EAL, so she doesn't really get ridden and it's not a big deal. Not that she couldn't, she was sound and happy, but it created a whole bunch of tension in her. And we finally settled. I worked with the vet. I spent way too much money x-raying every joint in that horse's body. And we couldn't find anything wrong with her. We finally settled on the possibility of ECVM, which is malformed cervical vertebrae. We couldn't see anything on x-ray, but we also couldn't x-ray deep down into the base of her neck. So, and I drew the line at the MRI because I had spent enough money. And anyways, I just chose to send her to that life. I regret it every day. I should have kept her because what I know now, even if I could just do walk work on her, I bet I could have affected a greater change. So I do deeply regret that one. But here we are. This was her mom for good measure. What I liked about this picture, well, I don't love it, but she's short in the stride and she's coming down toe first. This was normal for this horse. You can also see restriction through the base of the neck. She doesn't quite have the scope and she's not really pushing from behind. If she were pushing from behind, this pelvis would be a little bit more rotated and the muscles would be a little bit more developed. This happened to just be a good moment in time to snap the picture, but I look at this front leg and think it should be way out here by this post. It should be much longer through the stride if she had had a heel first landing. But this horse was also plagued with issues. Structurally in her hind end, she had a lot of things going on. She also had extremely upright feet, very contracted heels. I could never get a handle on the thrush on her. She was a huge challenge. She actually lives at the same place as her baby now, and they do EAL together, which is very cool, I think. Okay, let's pick another horse.
What is EAL?
Equine assisted learning.
Oh,
And so they do like obstacles on the ground where people come in and lead the horse, but nobody rides. This was a horse I bought, or somewhat rescued. She had quite the sway back. This was a horse, you can't see her feet, but she had the super long toe, low heel, very underrun. And this is, of course, an exaggeration of that posture. But She could not engage her thoracic sling. She's just hanging on her scapula here. Uh, Sway back, rotated pelvis, super tight up here. When I look at the pelvis in terms of rotation, like you can't really see. The croup is still higher than the base of the tail here, but if this horse could like if we could just reach into the picture and lift her belly up and bring this spine up, it would allow that pelvis to come back down and it would be a much different picture than what she looks like now. Okay, where's my little Arab? Right here. So this isn't the greatest picture, but this is my Arab legend, the one I said earlier that I wrote inverted and hollow forever. You can just see, he looks to me now, like at the time I thought he was the most beautiful horse in the world. I look at him now and I'm like, he's the horse that there was all these extra parts and whoever created horses just stuck them all together. Is kind of how I see most Arabs, if I'm being honest now. But I went through an Arab phase for a while. I really loved him. But you can see his neck, there's a huge missing piece of top line right in front of his wither. There's no top line behind his scapula at all. He's got the rotated pelvis as well. He could use to have that pelvis more underneath him and engaged. I just showed this picture because I want to show the next one. This is me riding him way back when. I thought this was brilliant at the time. I look at it now and I think, okay, actually, you can see he's stepping under with the hind end and lifting his back, but look at the lack of extension I have in this leg. Yes, it's forward and he's going to come down on his heel, but it is, again, it should be even more forward, and it's not because of the tension in the underside and the base of his neck. He's not truly lifting through his back. He's lifting through the hind end, and everywhere I'm sitting, he should be lifting right here, right behind the bucking roll on my saddle, and he is not able to because of the inversion in his neck right here. If he could drop his head, and it's not about a headset, I'm not meaning that, but if he could drop his head to release the tension out of this muscle, he could lift up right through the cinch area and engage that top line, and that would extend the stride by another 6 inches. But this was still pretty awesome. Also, I'm riding in a halter and my reins are under his neck, completely ineffective. I see that now. And I don't have a helmet on. That was a long time ago. Now I ride in a helmet. But either way, he's an awesome, awesome horse. But I look at him now and I see all the dysfunction in his body that I would now change and do differently. All right, let's look. This is his sister, Lacey. And same thing. Like, I'm not I'm not hating on Arabs. I love Arabs and I own a couple and have owned many. But same thing. This is the day she came to me. Look at this hind end. Like it might as well just be fluttering in space. There's nothing to it. There is no muscle at all. To me, she looks sore. It's tucked under. There's not enough angle in her hock or her stifle. She's not really engaging her thoracic sling, and you'll see in a moment she's got the same underneck as him. Interestingly, they came from the same trainer who bred and owned them forever. So, not that I'm hating on her, but maybe utilizing them in a different way, whoops, could change their body posture. I had a picture of her right here. So here's her in the round pan, and again, there's a little bit of her engaging the pelvis underneath, but to me, she looks really tight in the lower back here. She's not lifting the back at all. She's too braced right here. You can see it through her brachiocephalicus muscle. And look at this short little stride. I know it's not the extension phase of the stride, but there ain't no way she's going to reach out and have a big flowing stride. And this is not a reflection of these horses. It's how they were trained and ridden and worked, and I didn't know enough to change it. Long time ago. She was a great horse, though, Lacey. She taught all my kids to ride and did lots of awesome things.
Can I ask one quick question?
Yeah.
Christy? Can you show with your arrows where you want that pelvis? I feel like I'm following everything except for the pelvis gets me, and I think if we have a minute, if we could just show, I can see what you're saying, but where would I see a better, I can see she's uncomfortable, but show
Yeah.
where you would like that, if you don't mind.
Yeah,
This is just
in movement or standstill? Or both?
either way, like when you look at this, I see everything, but I just want to understand the pelvis more. Everything else you said except for the pelvis part.
Okay. like when I look at this picture, I
Yeah.
look I look down her hamstrings and I'm like, okay, they're round and engaged and her legs are coming under. That's great. But when I look up here, like at her croup and at her lower back, this significant downward angle tells me she is not raising her back and the pelvis is not truly underneath where it
Okay.
should be. Like I would like to see if I could just, let's see if I can open this in paint. Where is it?
I just find this so amazing, but I just want to see in my head where I want that pelvis to be, try to get a more keen eye.
Yeah.
Like you.
Well, and please, I'm no expert. Be careful listening to me. Don't follow me blindly.
I have for years and it's worth it.
Okay, hang on. We're gonna see if I can, let's make that thinner and let's make it something brighter. Okay. So if I could take this chunk of her pelvis, I would like to see it. Oh, wait, I'm moving the whole circle. Hang on. Can I select in a circle? Probably not, because that's what I want. Hmm. Oh no, it doesn't work like that. Why doesn't paint do what I want it to do? I want to lift this circle up and move it.
The movement you did kind of explains it when you were trying to rotate this circle.
Yeah,
Mhm,
like if I took this and could move it like that,
okay.
that's where I want her pelvis.
Okay, so kind of look at the point of that hamstring should point back and then that top would come up and the tail just okay. All right.
Yeah, because
Yeah.
mostly what it would do if I rotated that pelvis that way, if we look at this part of her back, it would bring it up more.
Yeah. Okay.
Like like that's the part that's missing to me. I see the pelvis, like she's trying to step under and engage, but ultimately what I see through the saddle and everything else is is like a saggy back, something like that.
Yeah, that's perfect. Thank you.
And what I want is that back to be coming up like this to really allow that hind end to come under and push through, if that makes sense. My poor horse.
100%.
I've butchered that picture, but that's okay. Okay, Lacey. Oh, I have so many pictures. Looking through them, I got kind of hung up. Let's look at Hop. Okay, like this little bedraggled homeless pony. What I love about this is look how short his front end is. Like his front legs look like they're a solid 6 inches too short. And this is because he's holding his fat self and all of me, like we're just falling through his thoracic sling, and I call it the scapula is holding us up. And what I mean by that is the scapula is a bone that is only attached in the front end via muscle and tendon attachment. Like that's a very flexible, loose attachment. And right here there is zero core or muscle activation to hold us up in space. We are 100% hanging on that muscle and tendon attachment in zero athletic way whatsoever. And his neck is short and compressed. He's all jammed in because of it. And as he's walking, this is the exact same thing as that last picture of Lacey. I want to rotate this pelvis and lift his lower back up, which would also lift up the front of the saddle here. Like he needs engagement there. Now, to be fair, I think this was like the second time I ever sat on him in his life. So this is not a picture of how we rode. This was very, very early on, but it's a great example of all of these things not working effectively. And if we look through, as I started developing him, this was not too far after that, actually. He's starting to come in through his hind end, but still there's a downward slope coming in through underneath the saddle, and he's still here hanging off of those scapula, meaning he's not engaging and lifting through that thoracic sling. And look at the length of his neck. It's not near as bad as the last picture, not by any stretch, but it's still short. The one nice thing this horse has always had going for him is he's never been super braced in the underside of his neck. But he was riddled with tension and fear, which is what caused that higher posture. And then what's after that? Probably these photos. I like this photo because it's very similar to this one here. this is obviously looks worse, but if we go back to that other one, what I see, my dog is so irritating today. What I see when I look at this picture is a rotated pelvis, a downward drop. Like, look at how much lower the front of my saddle is from the back. We are hanging off of his scapula again here, even though the next picture shows us elevated and lifted. Now, and what I love about this is real life. A horse is not going to be engaged and athletic and perfect every single second of every single ride. They are going to go through a fluctuation, just like I'm going to remember my posture and walk around appropriate for a little while, and then I'm going to forget and collapse, and then I'm going to remember. Same thing. This just happened to be a clinic where we had stopped and were standing, and I was talking to the instructor. And so the horse just kind of was like, yeah, I'm going to hang here. No big deal. If we look at the next picture in this series, I had gotten off and he was moving through. Now it's a little hard to see, but he's starting to come in under. He's lifting his back a little more. He's starting to engage his thoracic sling. Like, look at the angle of my saddle now. Now the front of the saddle is higher up. It's the exact same saddle on the exact same horse in the same moment. But the way he's moving is changing. He's starting to scope up through his neck just a little bit more. Things are coming together. Is it perfect? Absolutely not. But it's moving in an appropriate direction. And then look at this. Look at how he looks like a donkey. This was after all of that. This was just a photo shoot I had chasing the horses around the farm or around the arena. Look at Dixie. She looks like a moose without antlers. Like, absolute ridiculous. But again, I just want to point out moments in time. And for a minute, look at this little specimen right here, this little gray. This is Jack, my pony, and this is unusual for him. But this is what I'm talking about. Look at this pelvis, completely engaged underneath, our hamstring coming down. Look at his raised lower back. This, this is funny because this is not how this horse moves, but this is one snapshot in time where he's not braced through his neck. He could have a little more elevation in the front end, but he looks lovely compared to this little donkey in the middle here and my moose back here. But this was one moment. I'm running around with a flag chasing them to get great photos, and whether he was stressed or this was just like, I don't know what his hind legs are doing here. Just, it's kind of fun to look at that in context. Now let's go back to my little gray pony since we're talking about him. Okay, here he is here. Now again, this hind end, I like. It's starting to come under. See how he's raised through the lower back? He's pushing through, but the stride is going to be short because this under neck is too tight. If he could release this tension, and I mean, lower his head like a couple inches, not because I care where his head is, but lowering the head could disengage this muscle, which would allow him to scope up and out from C7, like up through his neck, and elongate it, which was that other picture. And again, moment in time, but these things are starting to come together. And don't look at this horse in the back. That's a disaster. That's Tango, who we're going to talk about in a second.
I love it.
That's a horrible moment in time for her. But let's stay with Jack for a minute. I had one more photo of him somewhere. Maybe. Oh, right here. Okay, again, now we've lost it all. Look at how that hind leg is not coming underneath at all. There is no rotation of the pelvis underneath. He's dropped through the lower back. His little under neck is fully engaged. This stride is going to be short. He will be lucky to make a heel first landing with this foot. And he's got great feet, but he's not going to make it because there's so much tension in the front of his neck. He cannot get this shoulder up and forward because he's also hanging off of his scapula with no engagement at all. I mean, this is a pretty nice picture of the buckskin. It's not as engaged as some of the other ones, but he does have some rotation coming through to push under. He's a little bit elevated. This is kind of like in the middle. It's not great, it's not horrible. Look at Tango here. Tango's hind end is coming in and engaged, and she is elevated up through her back. That's what I want to see. Now we can look at her. This is a nice disaster for you. I don't remember when this picture was, but what I am interested in looking at it is all the rippling coming down through her shoulders and the tension she's carrying in the base of her neck. I think this was last spring or winter. Um, I'm not totally sure, to be honest, but I look at her neck here and the tension through her shoulder and how downhill she is. Her hind end is kind of wafting, floating, not really doing anything. She'll find some better pictures of her. Well, maybe I didn't save very many of her. What was I thinking? I thought I had more of her. You can kind of see her here. This is what I want to see. Like this hind leg is coming in, pushing off, and look at that raised back. That is true collection from the hind end. And you can't even see, I don't care what her head is doing, but I want to see that uphill pushing through. That's a rare moment for her, that she's not super downhill heavy. I thought I saved more of her, but I didn't, I guess.
The interesting is when I look at pictures of horses that are engaged and moving well, they actually look weird to me because I'm so used to seeing horses in the other inverted position.
Right? Yeah, me too. It took a long time for me to figure out and recognize the difference between um, engagement from the hind end and then horses hanging off the scapula. Look at Dixie right here. We're going to talk about her in a second, but she's hanging off the scapula right here. There's no engagement anywhere past like right here. The hind end is doing nothing except holding her butt up. Her neck is all braced and tight, and she's just hanging there off those scapula. So is Jack. So there's not really a good picture not to show that here, but what I wanted to show here was Tango's neck and how all those ripples through her shoulder are gone and everything is a lot more loose. Even when she's coming through this stride right here and fully weighting this leg, that serratus ventralis is not bulging out in front of her shoulder anymore. We have done so much work on pillar 3. And you know what's funny with most horses when you work at pillar 3, you got to work on getting that head down and releasing that tension through the neck. With her, I got to work on keeping her neck up because she just wants to dive it down. And they can still be braced through their neck when their head is down. It's not about head up or down. I mean, it sort of is because it affects the change, but it's about the tension. And with her, I've had to work so hard on engaging that hind end under. And this to me, I know this is a stupid picture because she's stepping down, but I look at this and even stepping down, her back is engaged and she's using her hind end. That is amazing to me because I know how long this journey has taken with her. It's been ridiculous. Um, let's look at Dixie. I got so many photos of Dixie. Okay, this is that serratus ventralis muscle I'm talking about. You can see it on this picture because it's shadowed. So this is just popping out in front of her scapula. This horse doesn't have a clue how to use her thoracic sling and her core to hold herself up within her scapula. She's like me, hanging on it, except she doesn't have a collarbone. So her little neck is always jammed in and it is always rock hard no matter what I do. That's why I used her. And look at the difference between these two horses. Actually, this is a great picture. This is Senko, my yearling or my 2-year-old that I sold. But look at her hind end. Totally engaged, like tracking up by 8 inches. She's scoping up through her neck. She's not bulging. She could be holding her shoulders up a little bit more, but it's much different than Dixie. This is a gangly 2-year-old who has no idea versus a well-seasoned horse who's totally adopted all of the negative postures. Let's go through some more of Dixie here. I know I had a couple. Okay, same thing here. She's super tight and look how short her neck looks. Like it's just jammed in versus like Hawk is starting to scope out here. He's got much more elevation through the front end. His wither is high. She has a wither, but she's still got a downhill slope to her spine. Even Tango here, she's starting to get a neutral or even possibly uphill slope. And again, moments in time, this is, how it goes. But look at this hind end. It's doing nothing. There is no rotation. It's not underneath. She is not tracking up, not even a little bit. Too much tension and engagement in this underline and zero engagement in this top line.
It is kind of hard to look at your horses though, because they're so pretty. You just focus on the color.
I just pick them apart. This is what I think when I see any photo of my horses. I can't just look at them anymore and be like, "Oh." Now I just pick them to pieces. Okay, I
I
think
know,
I
but they're also
covered.
so pretty.
Well, I'm biased. I love them all. I love these pictures. These are from when we had a huge herd. Like, if you look at all these little ears in here. But what I wanted to show was Aspen here. I no longer have her. But look at the rippling in her shoulder muscles and look at this hind end coming under to stabilize herself. She had negative angles in the hind feet. Interestingly, she had hock and stifle problems. She was always sore in her lower back. Um, Standing camped under in the front. She was a mess. We ended up actually putting her down, which wasn't great, but she had too many things going on that we could not repair to even keep her comfortable. And it wasn't from a hoof care perspective. It was through her body and hind end. So that was kind of crummy.
This
But
was before you knew the body work and pillars work.
no, after. Um,
So why didn't it work?
she had too much damage to her hocks. Like she had arthritic changes in her hocks. Um, she also had well, I don't know if she had it. She was both diagnosed and I don't know if you call it undiagnosed with DSLD, degenerative suspensory ligament disorder. One vet said she had it for sure, and then another vet said, nope, doesn't have it at all. And there was too much conflicting advice, but she got to the point where she couldn't get up and down to lay down anymore. Her hind end was so sore, and perhaps someone way more skilled than me like could have found comfort for her to keep her happy, but I could not. And thought it was just the kindest thing to do because she was too sore. I think I kind of covered most of my pictures here. I hope that was helpful. I know it really wasn't like here's a foot and this is what it looks like. But to me, it's so hard to isolate them like that. Like, yes, there's these hoof pathologies and they usually look like this. Doesn't mean they always do and doesn't mean they never do. But to me, these are the patterns I'm seeing and I can't unlink them. I wish I could, like I said, I wish I could just go back to thinking I could jam my horses in and ride around. I'm like, okay, I felt so smart when I rode like that. Now I feel so, I don't know, like I'll never know enough. So I don't know. It's a whole different journey, but no, I'm way more peaceful now. I love my relationships with my horses have changed so drastically in the last year and a half. I got to thank Hawk because without him, without the struggles he gave me and the stress, I never would have I never would have been looking for something else. But the relationships are different and so much better. Um, I'm grateful, but it's a whole journey. Now I look at all these things and the tension they carry in their body. And like Brandy, you said earlier, the emotional part of my horses. I used to think I cared about my emotional state of my horses. Like I really did. But then I'd see them packing tension and be like, oh, I hope you figure that out one day. Like, now I'm like, no, no, I'll help you with that before we ride or do whatever we're gonna do so that we both feel better doing it. Totally different mindset.
It's
But
nice
anyways,
because yeah, I feel like a floundering beginner, and then sometimes I start to wonder, am I going crazy? And so yeah, it's cool to know that it's normal feelings and the, just the path you have to go down.
yeah, I'm 100% right there with you. And there are days I'm like, man, if I won the lottery, I would just move to the middle of nowhere and I wouldn't have to teach people or do anything because I feel like a little bit of a hypocrite sometimes to be like, let me teach you about this. Because then in the same breath, I'm like, I know nothing. Like, like, like I know something, but it to me feels so small that I'm like, who am I to be teaching you anything? I know so little. But then let's talk about feet for a minute because then I feel great and I feel like I can teach you that. But it's a very hard balance for me that I'm like, I just like to fade off into the woods somewhere and like focus on me for a minute because I feel like I have so much more to learn. Um, But Maverick, boy, he's on a mission. But anyways, yeah, I think it's normal. And I think that's how we know we're doing it right. If you're searching for answers and you feel inept, you're on the right track. That's what I've learned in my life. When you feel like you know it all and you don't want to learn anything, you're in huge trouble.
That all the people I follow and watch feel like you do. And I'm glad you're here. So
Well, thank you. I am too. I really, truly am. And I love, I mean, I guess I love that this is my group and I can do whatever I want. Like, I want to talk about horses. I want to have a Zoom where I know this is about feet. And I promise you, if you have a question about feet, I am here to talk about it. But if you don't, you're just going to have to listen to me ramble about something else. And like I said at the beginning, I would love to hear from more of you. Like, I'd love to hear your case studies and what you're learning, and let's just all share it together. Like, that is so cool to me. Cheryl Henderson, when I was working with her in the early beginning, she said to me, when one person is teaching, two are learning. And I'll never forget that, because I have never ever learned as much as doing these Zooms and these and my courses and my clinics. Like, I learned so much, and I see it in my apprentices too. When they come in and guest teach during my course, it just takes their learning from here to here, because now you're teaching it to someone. So you darn sure better know what you're talking about. And if you don't, you better sort it out. And the more you talk yourself through it, I think the more they learn. So, yeah, it's very, very cool. But all right. Well, you know what? When I started this morning, I was like, oh, it's going to be like a quick little half-hour video. I hope it amounts to something. We made it an hour and a half. So that's pretty good.
It was amazing.
yeah, I
That was
consider it the most valuable hours I've had in a while.
Awesome. Well, thank you. I appreciate you guys hanging out with me on your, what is it, Saturday morning? Sunday morning?
I think to remember, Chrissy, you're such a good teacher because you always share your vulnerabilities and you must share with people sort of some of your follies or where I was. Like it took a lot for you probably to show us some of your pictures. You're like, I've changed so much, I've grown so much. But you learning from that and showing that you're a lifelong learner also makes you an incredible teacher because yes, you have mountains of knowledge, ends of it, but you're not willing to say, I'm the expert. I've still got more to learn. And that humble and vulnerability is why we will tune in every week because you're that amazing and keep doing it because this is what you're meant to do.
I think I have my Zoom setting on smooth out my background so I don't look all wrinkly, but if it isn't showing it, I'm blushing. Thank you. I appreciate that. I think, you know what, we got to come from somewhere, and without, I find social media is so hard, right? Because you see something and someone's like, I'm perfect and everything's perfect and it's all lovely forever. And I'm like, oh, well, I really suck then because I'm not. And I think that it's so important to just be real about it. Like, yeah, okay, the only thing I never did was tie my horse's head down. I never really was a fan of that. But yes, I seesawed the reins and I rode them hollow and I did all the horrible things, and I ground my horse into the sand. Like, legend, I will forever be in debt to him. That's why I still have him at 30 years old, and he is living the best life and will forever till he's gone. I owe him so much. I ground that horse into 20-meter circles in my pursuit of learning dressage, and like, not that I ever tortured him, but I did things that I would never do now, and I do it so much differently, and he still loves me, man. He would do it all again. He doesn't know any different. um but I had to learn that. I had to. Even if I could go back right now, if I skipped that and could just know what I know, I probably would not be nearly as empathetic or understanding and do what I do now with as much feel, because you really have to learn it. As much as I don't want to, I'm kind of in that same place with Hawk. I'm like, I'm just going to sign up for all these clinics, and surely if I go see Josh 5 times this year, we'll just figure it out and it'll be magical and I don't have to deal with the hard. But I'm starting to come around to, no, I just have to deal with the hard and do it myself and experience it right and wrong in order to figure out the right moving forward. And that's hard because I don't want to suck at anything. I want to do it well, but I think that's the journey. Anyway,
I exact thought yesterday. Like I have to. They're always like, "Well, you have to play with it." I'm like, I don't want to play with it. I want you to tell me how to do
right? Wouldn't that
it.
be great? Yes, that's where I'm at. I just need to get on and ride my horse. I need to stop watching videos on how to ride my horse and actually ride my damn horse. That's how it needs to go, but I'm scared. So I got to get over it. I got back on him the other day. That was huge for me. I haven't ridden him since he bucked me off, and I was super nervous and it was lovely. I rode him for like 4.5 minutes, got off, called it a day. Well, I'll see where we're at today, but if he's in the right mindset, maybe I'll do it again. All right. I hope you guys have a great rest of your day. I'm gonna go and play in the mud because it's really warm and all our snow melted and everything is disgusting. So I'm gonna go try to harrow it and make myself feel better about it.
Mhm. Thanks
All
for
right.
showing. Everyone.
Hey, you guys have a great day.
Thank you, Christy.
Bye.